Warren schools are taking a stronger approach to their students' mental health and the issue of substance abuse. Joining us to talk about how the district's new partnerships came about and what this means for students and their families is Dante Caper, Associate Superintendent of Warren City Schools. Dante, great to have you with us. The district has partnerships through Thrive Counseling, the County Board of Mental Health and Recovery Board, and also Cadence Care Network. So how did all of that come together for this plan?
Absolutely. Well, thank you for having me. It's a pleasure to be here today. You know, the academic achievement of our students is our priority in Warren City Schools. And sometimes we found over the years that, barriers will come up to prevent a student from achieving, whether that's not having the proper school supplies in place, perhaps that's not having a significant food at home. Our educators have really worked hard over the years to meet those needs and to address those barriers. And we found it over the last decade to decade and a half that the behavioral health and mental health needs of our students is a growing one that we're also working to meet as well.
Why did the district feel it's important for schools to support kids and their mental health? What are you noticing in terms of behaviors and just some of the things that they're struggling with?
Yeah, so, a lot has gone out even prior to the pandemic, just about the increased mental health needs of young people, really people in general throughout our society. But I think it really shows up just with stress and anxiety, even before the behavior, some of the outbursts and things like that. I think young people are carrying a lot of stress, even if you look at some of the changes within the Mahoning Valley, again, over that last decade to decade and a half, from economic, housing, the opioid crisis, overdoses, and just sort of the impact that that can have on some of our kids. Again, that produces a lot of stress and anxiety. It may show itself in different ways. So we noticed that our kids, needed someone to talk to, needed someone to kind of work through some of what they were feeling and what they were dealing with. To get some appropriate strategies and interventions in place. So again, those barriers could be removed. They could kind of set the stress aside or know how to manage that stress so that they can be successful in the classroom.
Now, is this something you opt in? Is it mandatory? I know parents in Illinois, they're looking at something that's more mandatory for mental health screenings, but how does this work with the parents and the kids signing up?
Yes, it's totally opt-in. We're fortunate, again, through some of the partnerships that we have to have people in our schools who are able to just kind of make a connection and cultivate those relationships with kids. When our teachers or our school counselors notices that a student is struggling and they think that some of these supports may be a good fit, they take the initiative to call home to the parent to explain to them what it is, what it isn't, let them know that they think it may be a good fit for their child, just to, connect and talk with this person. And we sort of allow the agency and the parent, the family, to take it from there.
Dante, the district is also working with Thrive to help tackle substance abuse. Studies over recent years have shown more kids are vaping and using drugs like marijuana. How do you believe this partnership will help with that issue?
Yeah, absolutely. We're fortunate to have this partnership as well. And I think the number one entry point for us was that, coming to a point to realize, hey, we're not going to punish this out of a kid. Vape, marijuana, whatever it is, these things are becoming obviously legal and more socially acceptable. But they're also designed to cultivate dependence and even, some would say addiction from our students. So when they're dealing, with dependency and addiction, again, it's not something that's going to be punished out of them. So we felt like having an educational component, if something happens where a student is caught with one of these devices or, they're using, to be able to have an alternative to an approach that's purely punitive, that we're able to provide some education and also some intervention if a student needs it. And one thing that we were kind of pleasantly surprised to find out is that once these supports became available and when students became aware of them, they kind of let their friends know. And a student who is dealing with dependency or dealing with a level of addiction or just finding that, hey, I've tried this and it's difficult to stop using, they've taken the initiative to reach out to get some of the strategies so that they can stop using themselves. Because I think over time, kids are finding that, hey, it's maybe difficult to kick, or they try to stop and they realize that, hey, my anxiety's up. I'm a bit more irritable when I'm not using this thing, and they kind of realizing that it's not good for them. So we have a lot of students who are taking the initiative and who are looking for a way out as well. Okay. And we're glad that we're in a position to be able to help provide that.
So glad you have those resources and they're starting to show results. Really appreciate you joining us as always.
Hey, thank you so much for reaching out.